Today we have some valued colleagues from the cannabis regulation and also law enforcement worlds who are going to be talking to us about, oh, I got to get rid of this thing up here, sorry. Talking about some of their projects into contamination in illegal cannabis. So I'm going to kind of introduce them here. Let's see. So, oh, there we go. So first up today, I'm going to be speaking a little bit about the NCCEH's, or pardon me, just kind of introducing the why we're concerned about illegal cannabis in Canada. So I am a knowledge translation scientist from the National Collaborating Center for Environmental Health, and I'm the person behind the kind of cannabis agenda. So the NCCEH, since legalization, has been doing quite a bit of work about different aspects, environmental health aspects of cannabis legalization, growing at home, odors in communities, and now contamination in illegal cannabis. So if you're interested in our projects and products, we have just recently updated our cannabis resources for environmental health practitioners page, where you can find all of the stuff that I'm going to be talking about today. And it's something that I periodically update. It's kind of a curated reading list for kind of the environmental health issues surrounding cannabis legalization. So after I give my little spiel, we'll next be hearing from Kim Shelford on the line, who is the Director of Data Monitoring and Secretariat Operations for the BC Cannabis Secretariat. She was the project lead on an illegal cannabis testing project that we recently completed in June, and she will be sharing those results today. She brings 20 years of experience working in provincial government and has a focus on corporate planning, research partnerships, policy, performance management, and business administration. She's also joined by Hovan Bagdasarian, I said that right, Hovan, who is the executive director for the Cannabis Secretariat. And as such, he oversees many of the roles of the Secretariat, including helping partners, stakeholders, and the public understand the provincial and federal legal cannabis landscapes. And they also work extensively with BC First Nations on cannabis-related issues. So I believe Kim will be speaking more about the Secretariat's mandate later on, so I'll leave it there. And then after Kim, we'll be hearing from Rachel Huggins, whose most recent role is as the Deputy Director / Executive Lead of the Cannabis Legalization Group at the OPP's Organized Crime Enforcement Bureau. That's a lot of words. Prior to that, Rachel was the Manager of Drug Policy Development in the Serious and Organized Crime Division for Public Safety Canada. And she's also the co-chair of the Ontario Association of Chiefs of Police Substance Advisory Committee and a member of the Canadian Association Chiefs of Police Drug Advisory Committee. So she's very involved in leading initiatives to promote innovative and community-focused drug enforcement and harm reduction. So we're really lucky to have these two particular colleagues with us here today. I'll ask if you're not mute to please mute yourself, because everybody can hear you. So right, and then we'll go into some summary and key messages. So I'm up first. Just briefly, the NCCEH has been keeping an eye on what's going on in the public health world in the 3 years since legalization. So if you were unaware, and I'm sure you're not, the Cannabis Act came into force in 2018. And at that point, fresh and dried cannabis oils, seeds, and plants became legal to sell and possess and do various things with. Then in 2019, new classes of cannabis also became legal, including edibles, extracts, and topicals. So our public health goals throughout this, and I'm going to have to ask you to find that person and mute them. I don't see them. So our public health goals throughout this process have been really to destigmatize the use of cannabis generally, but also address and reduce problematic use, especially among young adults. You can hear me now? Okay, so since legalization, there's been just a kind of a flourishing of cannabis and public health research. However, the public health impacts of legalization are actually still quite difficult to assess. And I'm going to ask Anna to drop a link to this paper here, Fisher et al. 2020. And they look at some of the reasons why we're not quite at the point where we can assess like kind of the larger overall public health impacts of legalization. Part of that is because of vast provincial and territorial differences in regulations around cannabis and how it's accessed, which really affects, whether or not we're seeing problematic use or other public health issues. And obviously the last 20 months of the COVID-19 pandemic has also had a large impact on cannabis use and alcohol use as well. And we know that from initiatives like the BC Speak survey and other studies that have shown that during the pandemic, people have really increased their usage of cannabis and alcohol. And because they were at home, they may have also increased, or they may have also changed where they access that drug from, both drugs. However, so like we don't really know what the public health impacts of legalization are yet, but we do know that cannabis use patterns are shifting. So Health Canada runs the National Cannabis Survey, I think it's Health Canada, every 3 months. And that's been going on since February 2018. And so at this point, based on what I think is the most recent data, we know that 54% of Canadian cannabis users usually obtain their cannabis from a legal source. And so that would be, not an illegal online or storefront source. So that means that many Canadians, like many tens of thousands, are still buying from unregulated or illegal sources. So why is this a concern? Well, this is a concern. We're going to be talking about this today, about basically the relative safety of legal versus illegal cannabis. So I think it's useful to kind of explain to the audience what makes legal cannabis safe or safer. And that is really around the requirements for testing every batch or lot of licensed cannabis that is produced. And so that testing is quite comprehensive. It includes microbial contaminants like bacteria and fungi and mold, etc. It also includes chemical contaminants like pesticides, metals, solvents, aflatoxins, and it also looks at cannabinoid content. So this is, related to weed fraud. Are you getting the amount of THC or CBD that is promised on the label for which you are paying? So this is a kind of a consumer protection point here. If a cannabis sample fails, if a legal licensed cannabis sample fails this panel of testing, then Health Canada requires two things. First, they require a root cause analysis to be done to identify, if a pesticide active ingredient was found in the product, how did it get there? That needs to be explained, because if it was intentional, that's a really big problem. If it was not intentional, so for example, many greenhouses that may have legacy contamination from previous products that were grown there, if an active ingredient from one of those older products has gotten into the cannabis somehow, but it was accidental, then Health Canada will perform a health risk assessment to determine whether or not it's still safe to be sold. However, if you did it on purpose, then that is not allowed to be sold. So here's the issue. So Health Canada and its oversight, it knows quite a bit about what's going on with legal cannabis, but we actually know very little about what's going on with illegal cannabis product quality. So there's a blind spot, and it's related to kind of two major issues. The first one is that law enforcement encounters these products, but really has no mandate to analyze, no formal mandate to analyze or communicate health information to the public. That's public health's job. The other issue, though, is that on my side of things, on the public health side, it can be really difficult for public health people, even with a research license, to obtain access to illegal cannabis for research purposes. And we also, it's quite difficult for us to deal with the kind of analytical capacity required to test many different cannabis products. Every different matrix, every different kind of gummy or chocolate or food or oil or topical dried bud requires a different methodological approach, which we are just not experts in. So we really need those collaborations between public health and law enforcement, and also analytical labs. So I'm going to pass it over now to Kim. If you can unmute yourself, and I'll flip your slides.
Thanks, Angela. Hello, my name is Kim Shelford. As Angela noted, I'm the Director of Data Monitoring and Secretariat Operations with the BC Cannabis Secretariat. The Secretariat was established in April 2017 within the Ministry of Public Safety and Solicitor General, following the introduction of the Federal Cannabis Act. The Secretariat oversaw and coordinated the cross-government work required to develop the provincial cannabis regulatory framework. And with that, 5 goals were established to to guide the development of the framework and the ongoing assessment of cannabis legalization. And those are promoting public health and safety, protecting children and youth, reducing crime in the illicit market, keeping our roads safe, and supporting economic development. The Secretariat has continued with this as the coordinating body for non-medical cannabis policy across the BC government. And we also lead public education and awareness and work with key stakeholders and partners to increase legal market competitiveness and support Indigenous participation in the legal market. Next slide, please. So who are the entities that we work with? As noted, we do work across all ministries in the provincial government, from the Ministry of Health and Environment to the Ministry of Agriculture, Food and Fisheries, and Jobs, Economic Recovery and Innovation. Our key cannabis entities, though, are the Liquor and Cannabis Regulation Branch, who licenses cannabis retail stores and conducts compliance and enforcement activities with licensees. LCRB also oversees policy and regulations governing retail sales. The Community Safety Unit leads enforcement against those selling illicit cannabis. And the Liquor Distribution Branch operates the provincial monopoly wholesale distribution business and runs public-owned stores. So for this particular study on cannabis testing, the Liquor, Cannabis and Regulation Branch provided some of the funding to the testing, and the Community Safety Unit provided the illicit cannabis samples. Next slide, please. Why are we interested in illicit cannabis? Pre-legalization, BC had a substantial illicit market, both on the retail side, with many illegal storefronts selling unregulated cannabis, and also on the production side with thousands of growers supplying the illicit market in BC and much of Canada. So given this challenge, BC did create the Community Safety Unit, which is the only jurisdiction in Canada with an enforcement unit dedicated to cracking down on illegal cannabis sales. And while we are a few years into legalization, and the CSU has shut down hundreds of stores, seized millions of dollars of illicit cannabis, and there are 375 licensed private retailers, 30 public stores. Cannabis users in BC are still purchasing cannabis from illicit sources. And BC continues to be a major producer of illicit cannabis. So for example, if we're to look at the 2020 GDP for illicit cannabis production, BC is responsible for 40% of Canada's total illicit production GDP, which is 1.1 billion of the 2.78 billion. So many cannabis users have the perception that illicit cannabis is of the same quality as cannabis sold in the regulated market. So our goal of our study was to find out if illicit cannabis contained contaminants, and if so, at what level. Next slide, please. So for our study, we tested 20 dried cannabis samples seized from the illicit stores in the Metro Vancouver region. There are limits to what we can extrapolate from the testing results. The samples might not be representative of illegal cannabis throughout the province, and we have no information about the source of the cannabis and if it was from one or many illicit producers. In choosing which federally licensed lab in BC to use, our decision was based on lab proximity to feasibly deliver the sample, the amount of cannabis required for testing, the cost, and finally the lab's willingness to work with us. Samples were tested to the same specifications that Health Canada requires of license holders under the federal regulations. So Angela provided a bit of an overview of this. And specifically, we tested for the presence of microbials, aflatoxins, heavy metals, pesticides. And then we also wanted to confirm that it was cannabis and what the CBD and THC levels were. So the BC Cannabis Secretariat are educated and knowledgeable about the cannabis landscape in BC and nationally, but for the most part, we are not scientists. And so we partnered with Angela at the BC Centre of Disease Control and the National Clowry Centre for Environmental Health to help us inform what to test for and how to assess and analyze the results. We also consulted Health Canada as the regulator for advice on interpreting the federal regulations for testing cannabis. And we sought feedback from the private lab based on their experience testing cannabis and working with cultivators. The project culminated with the National Clowry Centre on Environmental Health publishing the evidence-based blog about the testing results. And the province also released some details about the specific contaminants for testing the results. And you can actually see the results as we receive them from the lab. That is posted, and I think they're going to drop that in the.
Yeah, Anna will drop the link to both the raw data and to the NCCEH kind of summary document into the chat, and we'll mail it to you after as well.
Okay, next slide, please. So what did we find? Well, we found contaminants. Only 2 samples did not contain pesticides, with a 3rd sample having trace amounts of mycobutanol. In addition to the pesticide contaminants, 9 of the 20 samples would have been considered unacceptable for sale due to the presence of various microbiological indicators of unsanitary production and elevated heavy metal concentration. Next slide, please. So you can see from the graph, in the red are those 9 highlighted samples that already wouldn't be allowed for sale due to the microbial and heavy metal contamination. And then we have an additional 8 samples that would require further investigation to determine how pesticide contamination occurred, whether any regulations were broken, and whether any health hazards exist for consumers. And you can see from those 8 samples highlighted in yellow that there are multiple pesticides present. In fact, we found 24 distinct pesticides, and the majority of samples contained 4 or more residues, and 1 sample contained 8. So the other graph shows the count of samples per those 24 pesticides. And you can see that the mycobutanol had the highest count and was found in 16 of the 20 samples, and another 2 were found in 11 samples, and so forth. If you did not read the blog, please do. The blog provides a full description of all the contaminants detected in the 20 dried flower samples and provides additional information regarding the human health and ecological risks of the pest control products that were detected. The findings highlight the importance of having and enforcing safe production practices. And the frequency and variety of contaminants found suggest that at least some illegal growers are engaging in practices that are not in the best interest of consumers or of their workers. Next slide, please. So what do we hope to achieve with the results? Our hope is that these results add to the ongoing discourse about illicit cannabis. Public safety remains our priority in BC. We are hoping the information will help consumers make informed choices. Whether you buy from an illicit storefront or an online seller, you don't know where it's coming from, whether it's free from contamination or fit for human consumption. In contrast, when you buy from a licensed seller, you can trust the label on the product. So where do we go from here? We're hoping for continued collaboration with public health on future testing. If we are to undertake it, we'd want to know from public health, like what your questions are, what further information is needed on illicit cannabis. This study was done in partnership with the BC Centre of Disease Control and the National Collaborating Centre on Environmental Health. We couldn't have done this or be seen as credible without their support, insights, and expertise. That's my highlight of my study, but I also invite Angela, who was a key author of the blog, to offer any other comments.
Sure, I'm gonna, in the summary, I'm gonna hit some of the key points that you made again. But yeah, it was really great working with you, Kim, on that. I really appreciated actually being looped into it, because it is a unique and very useful collaboration between our respective areas of expertise. So now we're going to hear from Rachel Huggins from the OPP. Take her away.
Thanks, Angela. And I have to say that I'm really happy to be here. I think that it's really important that we start to look at illegal and legal cannabis from both perspectives, both the public safety and the health safety lens. So next slide. So what I want to do is kind of give you an overview of the approach that we've taken at the OPP when it comes to cannabis. We also want to make sure that everybody understands that the illegal cannabis market hasn't gone away. So I will provide a short but kind of good overview of what's going on in the province with regards to the illegal market. And of course, one of the things that we've been focused on lately is really the connection to the Health Canada medical cannabis production regime and organized crime. I'll speak to a project that we did with the National Research Council on testing illegal cannabis and what we plan to do going forward in the future. Next slide. So I think that Angela gave a bit about my background. I do come from Public Safety Canada, and I was actually the manager responsible for the legislation from a law enforcement perspective. So I actually worked on the cannabis legislation and the development. And so coming over into the Ontario Police, my role was to prepare officers for legalization. So I came in about a few months before it occurred. And like I said, cannabis, the illegal market didn't go away, and we knew that it wasn't. We knew that organized crime was going to stick around. And so what the OPP did was they created the executive lead role and the Provincial Joint Force Enforcement Team. And we remained in the Organized Crime Enforcement Bureau, which is very important because it ties cannabis, it keeps it tied into some of the important elements when you think about organized crime. So within the Organized Crime Enforcement Bureau, you've got the biker enforcement, you've got contraband tobacco, you've got, proceeds. So we didn't want to, remove or place it somewhere else. We knew that the organized crime piece was going to be important. And because OSAB, which is the short word for Organized Crime Enforcement Bureau, basically they don't only work in the province, they work internationally and nationally as well. So we knew that we were well placed in the Bureau to keep connected. Now, the Provincial Joint Force Team, it came pretty much a few months after legalization, the team was set up. It's not a very large team, but it covers the entire province. So it's a roving team. They go where the priorities are versus being situated in just one area. So I thought it would be important to talk about some of the challenges. So everybody knows that when legislation gets put in place, there are always challenges adapting. So think about the adaptation that's needed when the entire legislation is new. And so while from a policing perspective, we really worked hard to get officers trained on all the new legislation, help them understand how to apply the legislation. And similar across the country is that the legislation overlaps. So you have federal legislation, and every province and territory has their own legislation or regulation. And so officers had to understand how to navigate those two pieces, including where it overlapped. So that took some time, but I think that we did a good job. There was also a number of procedural changes that really had to change. And I think one of the most important things is that we really had to help officers understand the difference of what legalization meant when dealing with individuals who use cannabis, because it was no longer an illegal commodity. And so it took some time to get officers to understand that it had to be treated differently. And I think that, it worked well. And there was also the public side. So we had to make sure that the public really understood what was going to be enforced and what wasn't. So while those things went well, we still have a lot of challenges around new legislation. We have been doing a lot of enforcement action, both at the frontline level and at the more specialty teams like the provincial team, the provincial cannabis team. But we haven't even really seen the results. Because of COVID, our courts are backlogged, and therefore we haven't really seen how the procedural approaches we've taken have played out in courts. It's slow to come, but we will know eventually what worked really well and where we may need to refine. The other thing is one of the other challenges is that everything in the Cannabis Act is technically considered criminal. which means that police are the ones who enforce it. So we introduced new activities within the Cannabis Act, such as promotion and advertising, but we deem them criminal. So this puts additional burdens on police to be the only ones enforcing the Cannabis Act. And so that meant that we had to really look at, or we have to really look at the difference between criminal and regulation and legislation. So it's really a place that we're doing a lot of thinking around, and we haven't really come to ground on it as yet. One of the other challenges is that with legalization, we have quasi-criminal enterprises and what I would consider some new criminal activity. The quasi-criminal enterprises that I'm talking about are legal entities that are involved in illegal activity related to cannabis. For example, a courier who delivers packages, but the courier company is also delivering illegal cannabis. Technically, you're not allowed to distribute cannabis. So we're seeing a lot of that. We have sites online that are advertising to grow your cannabis for you, sites that are advertising to get you high prescriptions amounts through the Health Canada medical cannabis regime. So all of those elements need to now be enforced by police. So the interesting thing about the OPP, and I say interesting because I don't think that it happens all the time, is that we've taken a hybrid enforcement and policy approach. So the approach is really about it. The enforcement is intelligence-led and strategic enforcement action that really works with a matrixed approach. So we've identified what the priorities are when it comes to cannabis, and everything is done through a matrixed approach and scored accordingly. We focus on policy and data, and we work a lot on our partnerships. And these are partnerships with non-law enforcement entities. We work with fire, we work with bylaw, everybody who can help support enforcement actions. And again, it goes back to the thinking that is everything about enforcement. We cooperate and work with anyone who wants to work with us. And that means the officers as well as the civilians within the provincial team. We're very open. We do a lot of public discussions like this one. We put out a lot of information to the public. We think that it's our role to be transparent with what type of enforcement actions we're taking with regards to illegal cannabis. We know that we're not going to enforce our way out of the illegal cannabis operations. And so our approach is that we would prefer to inform and move people. So enforce, inform, and move individuals who want to use cannabis, who are of legal age, into the legal market. So next slide. So I think that this slide really demonstrates that the provincial team has been very active, strategic, but very active. And while I'm not going to go into all of the numbers on this, you can take a look at them. One of the things that's important is that we look at, because we don't have a good understanding of exactly how much organized crime or criminal networks or what that illegal market, what's the amount of money that illegal market drives. What we actually did from all of these operations is we did a very small analysis, and we realized that since legalization, the Ontario legal cannabis market has sold approximately $1 billion worth of cannabis. And in about the same amount of time, the provincial team and the community street crimes unit of the OPP. You see them listed there. We have Central, East, Northeast, and West. They have seized almost $500 million worth of cannabis. We've, with a duty loss of about 130 million. And then you add on top of it that assets and cash that has been seized by the team is about 16 million. And so it's important to know that OPP is one service in Ontario, and there are 44 municipal police services in Ontario. So that's just the numbers for the OPP and the provincial team. That is a lot of cannabis being seized and a lot of money, a lot of profits going into the illegal market. Next slide, please. So the team has been very focused on, for the last year and a bit, on the medical cannabis production. So this is the Health Canada-led regime that allows individuals to grow their own or designate somebody else. So this data actually shows that while we have a very large amount of cannabis available, legal products, all different kinds, we are seeing the numbers related to these personal or designated production registrations going up in both of our provinces. So people may think, well, it's only gone up a few thousand. It makes a difference. These numbers were fairly steady for the years when before cannabis was legalized, and now for them to go up after legalization definitely tells you something. And it really aligns with the second point, which is the amount of the grams per day. So we're seeing a much higher dose of cannabis being prescribed with those individuals who ask for the personal or designated production registration. So you're seeing over the, the average dose, which is supposed to be 3.2, we're seeing way over that. And that ties into the over 25 grams per day. So we've got about 169 doctors in BC and 132 in Ontario that are prescribing over 25 grams a day of cannabis for medical conditions. Now, I don't know about anybody else, but that alarms me. I have taken a look at some of the research, and it is physically impossible to consume that much cannabis in a day, but it is being prescribed. We have been working very closely with Health Canada on that issue, and I know that they are taking actions as well to look at this overprescribing, but it is happening. And I just wanted to compare it, that last line on how many doctors are in each of our provinces in BC and Ontario. You can see that there's quite a lot of them compared to the small amount that's doing the overprescribing. So, from a law enforcement perspective, that does raise concern about why these, key doctors are overprescribing or prescribing such a high dose with regards to cannabis for medical purposes. So the thing about the designated production is that what happens is that you end up with a lot of plants on a site, and without the type of regulations, individuals can grow more cannabis than they're allowed to. And so if you go to the next slide, I wanted to kind of give a sense to everybody of what cannabis, these large cannabis production sites, means to our communities. And I think that the next few slides are really going to speak to the quantity, but also those health and public safety issues. So everyone may think that this is a nice, pretty pink sky. Well, it's actually not. This is the way the sky looks in one of our communities in Ontario, where there is a massive amount of cannabis grow operations going on. And so this is what those hydroponic lights and those and those greenhouses, this is what the sky looks like when you're approaching that community. And I did not know until they showed me this picture. So you think it's picturesque, but it's actually not. Next slide. So these are not mom and pop operations. This is not somebody who has a medical condition like glaucoma who's growing cannabis because they want to produce a certain strain to improve their health condition. These are sophisticated operations. These are hundreds and thousands of dollars to just set these cannabis production sites up, and the land that they're on can be upwards to $1 million. This is in prime agricultural land. So this particular site was actually authorized to grow 1,500 cannabis plants from Health Canada. And on its location, when it was taken down by the deficit, it had 33,000 plants on it and 450 pounds of processed cannabis. And it also had resin and shatter. And you'll see some of the pictures later on that actually show you what that looks like. So next slide. So this is another operation. Very sophisticated. You see how every plant is growing in its own little pod that reduces, it from moving. So this site was actually authorized for 1,700 plants. This location had 22,000 plants on it and 250 pounds of processed cannabis. So next slide. So this is an aerial view. That's not a small piece of land that's growing cannabis. Next slide. So if you ever want to know what 100,000 plants looks like, this is one of those operations. This was related to our project Woolwich, which occurred in 2019. Next slide. So you can see the sophistication of the operation. They transition the plants and the lights and everything so that it's faster growing. Next slide. And then into full grown plants. This property was extremely large and it took tremendous manpower. Next slide. So you see that this is just greenhouse after greenhouse of plants. So just so everybody knows, in each one of these operations, every single plant must be removed. So this is not a small task for officers when they take down these operations. They must count and remove every single plant and destroy them. Next slide. I just wanted to give you a sense of what these plants can look like. So this is a cannabis plant and you can see the little man on the side. They're definitely not small. Next slide. This is the packaged cannabis that was found at one of the operations. Sophisticated operation. Next slide. So I think that without a doubt, these are not similar to the Health Canada licensed production sites that are strictly monitored and regulated for the legal market. You see mold, there are mites that are on these products and there is no regulation. Next slide. Contaminated water was found on these operations. Next slide. This was actually sewage, so it was a broken sewer that was pouring into the room, and the garbage bags are actually filled with cannabis product, and you can see that they're partially in the water. Next slide. We found so paint, chemicals. Next slide. This is this is their chemical storage area. Next slide. So if you could see on the corner, there's a candy bake there. So they're making a shatter here, but these are the conditions that you find in these properties. Next slide. Next slide. Propane lined up, so no safe, this is very dangerous, no safety hazards. They're all safety hazards. Next slide. Yeah, next slide. So one of the things that we have been finding at these sites is migrant workers. And so I think that this was one of the better conditions, better places that we found. Next slide. But still, you have individuals who are cramped in, they're living on site. So this wasn't adjacent, this is on the same site with all of those cannabis plants. Next slide. We can't say enough about the weapons. We've seized weapons through these. There's violence that goes on these cannabis production sites. Some, even though they're illegal, they're operating illegally or maybe doing illegal activity, we do hear and they do report criminal activity, but these are some of the weapons. Next slide. And of course, very lucrative. So this is some of the money that was seized at one of the takedowns done by the team. Next slide. So this is a really good video, and they're going to drop it in that you can look at that really walks you through. We've been, as I said, very transparent. So we have put out quite a number of media pieces that really give people an inside look at both the public and health safety issues within these production sites. Next slide. So finally, to the National Research Council and our project with them. So very early on, we took down a lot of the illegal cannabis stores that were operating in Ontario. That was the team's first priority. And from them, we seized a massive amount of cannabis products that were topical, vape pens, gummies. And we thought, you know what, we need to be able to articulate the dangers associated with them. So we partnered with the National Research Council. I had done some work with them in the past on oral fluid screening devices. And we set out 3 priorities for our study. One is that it was mutually beneficial because they wanted to test their methodology and their standards. We wanted to get the THC accuracy. Angela and Kim both mentioned about what's in that product from a THC perspective. And then, of course, we were very interested about other illicit substances because we had heard that cannabis was laced with fentanyl. And we wanted to know whether or not those things were actually occurring. And then, of course, the banned and prohibited pesticides. And so next slide, everybody's going to get a little bit of a perspective of what we found. So on the vape liquids where there was identification of what was in the packaging from those storefronts, we did find that the few that we did have and we did test, they actually were not accurate in their THC level. So although they were advertising 90% THC, we found between 45 and 60. And so when you compare that to the legal cannabis market, in Ontario, the testing and the outcome is about 80% THC consistent through their products. So there was a comparison done. On the vape liquid, we found the same pesticides and microbutanol. I can barely say microbutanol was found both in the vape product as well as in the cannabis bud that we tested in. So what we wanted to do was link the testing of the cannabis bud product to our operations. So we had ones from the operations that you saw the pictures from above tested, and we found that several thousand, that microbutanol was found several thousand times higher than what's the detectable limit for identified by Health Canada. Now, you know, NRC are the experts, and they have advised us that it's linked to cardiovascular issues, respiratory, and neurological illnesses, especially because it creates hydrogen cyanide. So think about that, you know, in bud product in these high quantities in these production sites. So our dried cannabis and our cannabis products, so the edibles that we've seized, will continue. We want to continue working with the NRC. We chose not to go to an outside lab because we wanted to make sure that our standards for all our products were the same. And it slowed down because of COVID, but we are going to continue to work with them to find out more information from the products that we've seized. So next slide. So, I mean, from an enforcement perspective, of course, our priority is enforcement. But we really have a bigger plan when it comes to working better with our partners. We don't think that the police services are best placed to provide health information, but in addition to all the things that you see we will and want to do on this page, we want better partnerships with public health. I think that we recognize that we have lots of information. We have now we're doing our own testing with the NRC. We're happy to share and provide information to others so that we can get that health message out along with the messaging that we're doing from a public safety perspective. And I think, you know, I told Angela this has been a long time coming because we've tried to work closer together as well. But we need others to step into the illegal cannabis sphere and help us move individuals who are using cannabis into the legal cannabis market. It's not, we're never going to get all the bad guys. We're never going to get all the operations, all the illegal activity. But what we can do, and we've seen it happen before, and tobacco is a great example, we can move people off of the illegal cannabis market. And so that's my messaging to everyone. Thank you.
I muted myself. Thank you very much, Rachel. So I want to leave some time for questions. So I'm going to move really quickly through this last little bit here. In addition to Rachel and Kim's projects, there's been another project that came out of New Brunswick recently that looked at legal and illegal products. So if you want to see really how the illegal cannabis stacks up against legal product tested using the same methods, this is a great read. It's about 12 pages long. It's very well communicated. So Anna has dropped the link there, and please do check that out. Just to kind of sum up about some of the public health implications that we've seen from these various projects, and I'm including the New Brunswick one as well. We know at this point that illegal cannabis contamination is probably quite widespread, as it is in other poorly regulated or illegal markets and in other parts of the world. So illegal cannabis contamination is not unique to Canada. As Rachel's data showed there, we didn't spend much time on it, but the product level or the pesticide levels in the vapes was much higher than in some of the other products. And that's because the process of concentrating concentrating the product is also going to concentrate any contaminants that's in there. About the risk of health effects, we've talked about this a lot. In our particular project, we did not do a health risk assessment because we didn't think that our sample was representative of everything that's going on in illegal cannabis. So we just dipped our toe in the water and we found a variety of different contaminants at different levels. And so I specifically didn't want to do an HRA where we would be, coming to some sort of conclusion about whether it's risky or not. However, I will say that there may be other contaminants that are out there that are in cannabis that are not part of the standard panel, and so we wouldn't have found them. I have other concerns also about safe production not being prioritized, and that is that as the legacy producers, the legacy illegal cannabis producers move out of the legal market and get licensed, the remaining illegal production is going to be left more and more in the hands of these people who do not use safe production practice, who do not care what happens to the consumer. And so I am actually quite concerned that contamination in illegal cannabis will get worse over time. And also, as Rachel showed in some of her horrendous photos from those grow ops, there's also ecological and occupational health risks here, both to the environment, the communities surrounding these grow ops, as well as the people who are, through whatever means, are working in these unregulated environments. So what is the role of public health here with regard to illegal cannabis? Well, right now we can see that the conversation is being driven by regulators and public safety and industry. Industry loved me and Kim's project. It by far the biggest uptake of our project results on social media and in media citations was the regulated cannabis industry saying, see, look how bad this stuff is. But that's not necessarily what we want. We want the public health world to also take a look at these results and consider how they might play into our role as risk communicators to the public. So if you've done any kind of risk communication around illegal cannabis, please share back your campaign with me. I would love to see what you're doing. We also need to be thinking about risk communication to healthcare practitioners, as Rachel was explaining, who are involved in this kind of over-prescribing thing, which is really playing into the hands of people who are doing, organized crime, essentially. So BC Cannabis Secretariat recently developed a prescribing fact sheet for medical cannabis, which is, has the blessing of the College of Physicians and Surgeons, and it can be accessed at the link that Anna will have just dropped. And it's really just kind of explaining to people about how overprescribing can lead to these other issues with illegal production. And finally, I want to make a note here. We know that cannabis, illegal cannabis specifically, plays a role in harm reduction. We know that there are people out there who buy illegal cannabis to transition off of or away from or reduce their use of opioids. And so for those people, we don't necessarily want to scare those people away from their illegal cannabis, because their illegal cannabis is definitely less risky than their illegal opioids. However, when we're thinking about those particular people, trying to provide access to a clean and safe product should also be consideration, but not to the point where they would not use the cannabis and would still continue using the opioids. That would be a bad use of that information. Okay, just to sum up, and we'll take some questions. Health Canada regulates producers, but it's not necessarily mandated to monitor or risk communicate about illegal cannabis. So we have a real blind spot here. Our data indicates that the contamination is common, and as more of the legacy producers go legal, the problem may get worse, and who will respond to that? So overall, what we're asking for here from this public, from this audience of amazing public health professionals, that we need more widespread risk communication about illegal cannabis and the safeguards in the legal system. And I welcome your inspirational thoughts on how we can make this happen. So we'll take some questions. I see there are a lot of questions, my goodness. Do you have one lined up, Anna?
Yes, I think there was some questions about Kim's study, and someone also has their hand up as well.
Well, we'll see here this study to, I see what you mean, from Pauline Liu, where your study results shared with any users of illicit or unregulated cannabis in health promotion materials. We did some sort of communication through the NCCEH, but that is really aimed at the public health units and the public health professionals. So the NCCEH doesn't speak directly to cannabis users. BC Cannabis Secretariat did some public outreach, but at this point, what we're looking for is for the messaging to be coming from the public health world. And so that's why I'm really curious to know what others are doing out there around illegal cannabis. Are we engaging with it? Not so much, because we didn't know there was a problem. And, you know, I'm very interested in hearing your thoughts on that. Do you have something to add, Kim?
Yes, so we did do the public release and it was picked up by media. And then the second piece is we did the liquor cannabis regulation branches dropping a buy legal campaign, and it links back to this study again. So I think Jess is going to drop that in the comment section as well.
Great. So Cheryl had a question here. How do these results compare to the amount of pesticides, microbes, and heavy metals in the illicit samples? A really good study to read is that one from New Brunswick, because they looked at 12 illicit and I think 6 licit, and they do a comparison, and there really is no comparison. The legal sample is consistently cleaner or clean, and that is because those lots are not allowed to be sold unless they're shown to be clean. So just let this person in. Oh, Sahil. Hi, Sahil. How would distribution on slide 13 look like for illegal cannabis? I don't know what slide you're talking about. I'm going to have to just go back and peek here. Oh, so yeah, this is a similar sample when we're talking about legal cannabis. And yeah, you should be able to see it there. So as I mentioned, the legal product is not allowed to go out unless these things are not there. Some active pesticide ingredients are allowed to be there, but if they are there, Health Canada will have done a health risk assessment to ensure that there's no risk to the public consuming that. Alrighty. Do you guys, Rachel or Kim, do you have anything to add about doing comparisons with legal product?
Well, this particular study was focused on the dry bud sample, so we could do a comparison of what does the legal product have to do in comparison to the illicit. So we were trying to make that comparison. We haven't, I would say for future testing, we're going to look at probably having to do comparisons of a regulated to an illicit product, because we don't test the finished product in the regulated market. So we would have to be like New Brunswick and pull them. So considerations for the future, I guess I would say.
Yeah.
Yeah, and I'd have to say the same thing. I mean, first the NRC has to actually test the illegal products for us. And of course, similar in Ontario, we have the Ontario Cannabis Store, which is our regulator, our distributor. So they can do that comparison because they have the ability to look at what we've got and what the Ontario market has from a legal perspective. So I think the comparison is much easier than we think, but we first have to test the illegal products.
Great, thank you. So I see a hand up from Richard. Richard, did you want to put a question in the chat or you want to speak? Richard Wooten. Hey.
Hi, happy to speak if that. Hi, how are you?
Good, thanks.
Good. Can I just post a question then?
Oh, you could just speak. You're up.
Yeah. All right, perfect. So thank you. This fantastic presentation. Really benefited from it. Just something that I'm observing, sort of getting reports from Canadian poison centers of pediatric exposures to high dose illegal cannabis edibles. Suspected of being sourced online, and some of the frustrations that I'm hearing from people that are reporting to me, you know, we forward these on to the RCMP, but there are so many online retailers and the overtness of how they're operating with even advertising, here's an illegal product, but here's our storefront address, a local phone number, 1 hour delivery in this region or that region. I'm wondering if there's more. I completely agree we need to do more with the public health messaging, but even coupling that with enforcement of some of these overt operators online, if there's more that can be done in that space, particularly when we have documented evidence of harms to pediatric population as a result of specific products.
So maybe I'll take that question. So we are I think the interesting thing about online is that even though it may be coming from Ontario, it's accessible everywhere. So we do monitor the online sphere for illegal cannabis. We are working actively on operations that tie those online providers together. So from an enforcement perspective, I think that every police service is actively trying to work together. And I know Ontario is definitely working with BC as well, because of course there are producers there and sellers, and they're all using the online space. One of the things that was on my last slide that I didn't want to take up too much time, but the Canadian Association Chiefs of Police have struck a special purpose committee to look at the cannabis legislation writ large from a policing perspective. So policing and public safety. I'm one of the co-chairs of that committee, and the RCMP Claude Castonguay is the other co-chair, and we are looking at putting forward a piece to the CACP along with recommendations on how to strengthen the legislation from a law enforcement perspective. What's worked well, because I think that some of the things that law enforcement have done from a public safety perspective is going to continue to work well as other drugs. You know, we hear about decriminalization, but the online space is one of the things that we need to look at from a legislative and regulatory perspective. We can't solve the online issue without changes to legislation. It can't be enforced the way we can go and to a storefront and close a storefront.
Thank you. That was very appreciated.
Thanks. All right. So we are way over time, but I can take one more question here. Let's see if there's, yeah, if you have to leave, that's fine. I apologize for going over a lot. I knew that this group was going to get lots of good questions because we don't hear from people with this profile very often. Well, here's one that is interesting. As a practicing acute care pediatrician who has seen a significant uptick in the number of cannabis overdoses in young children, I would say that's really hard to distinguish between legal and illegal products. And most families assume anything that can be bought is legal. So this is the crux of the problem, is that people think because you can do it, it must be okay to do it. Yeah, do you guys want to speak to this? I mean, this really speaks to the point of your activities, urging people to buy legal, but also for the need for this messaging to come from public health and saying that, you know, we need to be more clear about what is safe and what is not.
I think one of the things we did from an enforcement perspective is we prepared the public of what to do with regards to what's legal and what's not legal. And I think that I think the comment is correct in that you go online and a site is there available for you. If it's a legal commodity and it's a site online, then what makes it illegal? And so they just order from it. And we actually contacted the Better Business Bureau. And it turns out that the Better Business Bureau has a ton of complaints from individuals who tried to buy cannabis from an illegal site, didn't know it was illegal, and complained about the site. So that means that our communities, our people, our citizens don't necessarily understand how our regime works. So that means that if we want them to use safe, legal cannabis, then we need to inform them of how the regime works over and over and over again.
Kim, do you have anything to add?
I would say that the Health Canada regulations do have restrictions on packaging, that it is to make it not appealing to children. So when you're seeing something that looks like candy, it's illicit.
Yeah.
It's illegal. And generally around Halloween time, there are usually kind of reminders of that going out. So there'll probably be information coming out next week or soon. I guess it's like the hell, yeah.
Well, I would like to thank our speakers once again very, very much for joining us. This was a great session. Our email addresses are up here on the final slide. So there's many more questions to be answered. You can forward them to me or to the speakers and we'll try to take care of them. And other than that, thank you all for joining and we'll see you for our next seminar next month.